Cleaning of the hospital environment. Routine cleaning is important to ensure a clean and dust-free hospital environment. Most patient care areas should be cleaned by wet mopping. Dry sweeping is not recommended because it disperses dust. Any areas visibly contaminated with blood or body fluids should be cleaned immediately with disinfectant solution. All horizontal surfaces such as floors, tables, and all toilet areas should be cleaned daily. Isolation room and other areas that have patients with known transmissible infectious diseases should be cleaned with disinfectant solution at least daily. Frequent cleaning is needed for COVID-19 areas, and now especially we have a pandemic. Disinfectants use surfanios or quaternary ammonium compound and bleach or sodium hypochlorite with 1:10 dilution to clean surfaces or our environment. Improving cleaning or disinfection practices. You have to pay close attention to cleaning and disinfection of high-touch surfaces in patient care areas, such as the handrail, the doorknobs, and then the colite. You have to ensure compliance by housekeeping staff with cleaning and disinfection policies and procedure. Housekeeping supervisor conducts visual inspection and ATP testing to check compliance of housekeeper to cleaning and disinfection. Disinfect or clean environmental surfaces on regular basis and when surfaces are visibly soiled. Due to COVID-19 pandemic, Makati Med deploys more housekeeping staff who will do frequent cleaning and disinfection on commonly touched areas, such as the escalators, the handrail, doors, and doorknobs, and common areas in the hospital to prevent transmission of COVID-19 infection. Aside from surface cleaning using bleach solution, our housekeeping team also conducts misting and UV light disinfection regularly. So this is the frequency of the cleaning and disinfection using misting and UV light by our housekeeping department. Reminders, frequent cleaning and disinfection of work areas should be done by all. You have to focus on frequently touched areas such as the doorknobs, the keyboards, telephone, tables, chairs, etc. Inform the housekeeping team regarding schedule of general cleaning and disinfection of work areas or office. If a confirmed COVID-19 case has been identified among patients or staff, perform terminal cleaning and thorough disinfection of the area. Next is sterilization and disinfection. What's the difference of sterilization and disinfection? In sterilization, we destroy or eliminate all forms of microbial life and is carried out in healthcare facilities with physical or chemical methods. In disinfection, we eliminate many or all pathogenic microorganisms except bacterial spores, which can only be killed by sterilization on inanimate objects. Disinfection is not a sterilizing process, and this must not be used as convenient substitute for sterilization. In determining if we're going to disinfect or to sterilize an item, we have to classify if they are critical, semi-critical, or non-critical items. Critical items are items that enter normally the sterile tissue or the vascular system. These items should be sterilized since they are entering the sterile tissue. Example of critical item are surgical instruments. For semi-critical items, so these are items that comes in contact with mucous membrane or non-intact skin. Example of semi-critical items are laparoscope and endoscopes. These items should be sterilized or subjected to high-level disinfection. Non-critical items are items that come in contact with the skin but not the mucous membrane. Example of non-critical items are bed pads, blood pressure cuffs, couches, and computers. For non-critical items, we have to perform cleaning or low-level disinfection. So we can use 70% alcohol, surfactants, or bleach in disinfecting non-critical items. Remember to disinfect with 70% isopropyl alcohol your BP caps. And then also clean and disinfect your stethoscope after each patient use with alcohol swab. Disinfection. Disinfection is a process that eliminates many or pathogenic microorganisms with the exception of bacterial spores on inanimate object. So we have three levels of disinfection. So we have high level, intermediate, and low level disinfection. When we say high level disinfection, it destroys all microorganisms except for some bacterial spores, which is only killed by sterilization. High-level disinfection is done especially if the object is heavily contaminated. Intermediate disinfection inactivates Mycobacterium tuberculosis, vegetative bacteria, most viruses, and most fungi, but does not always kill bacterial spores. It is also somewhat similar to high-level disinfection. Low-level disinfection can kill most bacteria, some viruses, and some fungi, but cannot be relied on to kill more resistant bacteria such as Mycobacterium tuberculosis or bacterial spores. For routine cleaning and disinfection of medical equipment or devices such as stethoscope or thermometers, a hospital-approved disinfectant or 70% isopropyl alcohol is used. BP cups should be disinfected with 70% isopropyl alcohol. Dedicated BP cups should be used for patient on contact precautions. Stethoscopes should be cleaned or disinfected after each patient use with an alcohol swab. A sporicidal wipe is used for surface cleaning and disinfection of frequently touched surfaces, such as bed rails, ivy poles, doorknobs, etc., of rooms and medical equipment or device used on patients infected with C. difficile. Because remember, C. diff is not killed by alcohol, so we have to use sporicidal wipes. Handling patient care equipment. Handle patient care equipment sold with blood, body fluid, secretions or excretions with care in order to prevent exposure to skin and mucous membranes, clothing, and the environment. You have to ensure that all reusable equipment is cleaned and reprocessed appropriately before use on another patient. Handling soil and contaminated lids. Handle, transport, and process used linen that is soiled with blood, body fluid, secretion, or excretion with care to ensure that there is no leaking of fluid. Remember to use PPE when handling linen. Inspect for needles, syringes, etc. while stripping. Contaminated or infectious linens are placed in a yellow double plastic bag sealed by a net. There are devices that are classified as single-use, but due to cost and limited supply, they are being reused. Before it can be reused, it should be approved by the Advisory Committee on Reuse of Single-Use Devices. MMC has a policy on reusing single-use medical items. This is the policy on reuse of single-use medical devices. All requests for reuse and reprocessing of single-use devices and open but unused single-use devices shall pass through the Advisory Committee on Reuse of Single-Use Devices. All units who have requests for reuse and reprocessing of single-use devices should submit the following documents to IPC for review of the Advisory Committee on Reuse of Single-Use Devices. The following documents are the manufacturer's recommendation on reprocessing and legal reprocessing procedure, including inspection, cleaning, functionality testing, re-sterilizing, and repackaging. The device specification, available literature supporting patient safety on reuse of device, defining criteria which should indicate the following. Device classification, is it critical, semi-critical, or non-critical? The maximum number of reuses specific to the device. Parameters to be used to check if the device can be reused. and then the sample of the reprocessing card, which contains the following information: name of the device and its system application and product code, date the device was used, complete name of patient on whom reusable device was used, complete name and signature of technician, staff who perform reprocessing and fill out the reprocessing card, device classification, critical, semi-critical, or non-critical item, maximum number of reuses specific to the device, type of processing procedure, parameters to check if the device can be reused, and date the device was discarded.